Tonight we're going to talk about gastrointestinal health of horses, and I'm going to start off a set of 2 lectures. So the program for tonight is this, where I'm going to talk about the introduction, the anatomy and the function of your horse's gut system, and then I'll look at some of the common diseases, not all of the diseases. Guys, can you hear me down the back down there okay? Yep, good. And then we'll have a bit of a tea break, some prizes, some questions, and then Dr. Beetson, who is a consultant for our practice, she heads up our laboratory and diagnostic side of our practice, and she'll be talking about some of the laboratory work that we do and that we're innovating in the practice with respect to gastrointestinal disease. And she's a world expert in this area, and she consults to very many practices around Australia on clinical pathology. So let's just start off here with the anatomy of the gastrointestinal system of the horse, and it's a pretty complex organ, the gastrointestinal system, or set of organs. I'm going to leave much to probably Derek's disdain, I'm going to leave the teeth and the mouth out of it.
Damn it.
You don't have a particularly effective gastrointestinal system without healthy teeth, but that's a subject for another day's discussion. The esophagus, we don't get much goes wrong with the esophagus. Fortunately, the most common thing that goes wrong with your horse's esophagus is what? Who can tell me? Choke, yeah. And normally that is an exciting thing to have your horse do, but it's something that usually fixes itself without much intervention, and very rarely does it cause long-term problems. Unlike other animals where we see cancers and all sorts of inflammatory diseases in the esophagus, we don't tend to get that in horses, thank goodness. The stomach, though, if you've had a horse and over the last 30 years, 40 years, you will have seen an explosion of interest in diseases of the stomach of the horses, primarily gastric ulcers, and for very good reason. So tonight I'm going to talk a bit about gastric ulcers. But the stomach in a horse relative to its size and the other bits of the gastrointestinal system, the bowel, small bowel, large bowel, the colon, the appendix, is quite small compared to other species. So its role is definitely not as important as other herbivores, so other grazing animals, and that's because the horse is a monogastric animal. It's not a ruminating animal, unlike cattle and sheep and deer and ostriches and alpacas and all those other things that are out there, goats and so forth. The horse has a very different grazing and anatomy system for its digestion than other herbivores. And the bulk of it is the large bowel, not the small bowel. The small bowel, the small intestine, the stomach take up very little of the basic space. So there, if you cut the gastrointestinal system out of a horse, you end up with that, which is 9% of the size or the volume. The weight of that is the stomach, 30% is the small intestine, and 61% is the hindgut. So the horse is known as a hindgut fermenter. So it uses its large bowel, its colon, and small colon, large colon, and the cecum, which is here, for its digestion process. And that's very unusual for a herbivore. And it's what creates the diseases that we see in horses as herbivores that we don't see in other herbivores. So if you're a hobby farmer and you have horses on your property, you probably will have had a horse with colic, but the sheep on your property, the cattle on your property, they don't get colic. It's grazing the same pasture, the same feed, because they have a very different plumbing system and a very different digestive system. So let's talk about what a lot of people want to talk about, and that's gastric ulcers. So the gastric just means stomach, ulcer means erosion, and horses have had stomach ulcers for a very, very long time, domesticated horses. It's not a disease we see in non-domesticated horses. So horses out wild in the pasture are generally not affected by gastric ulcers. And in my early years as a veterinarian, 30 years ago, 25 years ago, we didn't diagnose gastric ulcers. We didn't diagnose them, we didn't treat them. We had no way of diagnosing gastric ulceration in horses back in those days because we had no way of seeing those ulcers. They don't usually cause death, so it wasn't something that we looked for in horses that died or were euthanized for whatever reason, but they cause disease. And it wasn't until the invention of the 3-metre endoscope, which really only has a veterinary use. It doesn't have a human use, and most of that diagnostic technology comes from the human field, and we use it in the large animal and the veterinary field. But there aren't too many people that need a 3-metre gastroscope. So it took a company to, with a market, and then we said, well, we don't see horses with gastric disease, so why make a scope? Why build a device for a disease that we think is not there? Well, some people did some very good research in the 1970s and 1980s and found that horses do suffer from gastric disease. And so we need to look at it in the living horse, not in the dead horse. And so to do that, you need a gastroscope, which needs to be very long, 3 metres long for most horses. Well, the little minis and Shetlands, you can scope them with a 1-metre endoscope, but really your average horse, you need a 3-metre gastroscope to have a look. And once they found these ulcers, it was then like when humans were first diagnosed with stomach ulcers, and it's a fairly new disease in humans, is why? What causes them, how, why, and how do we treat them, and how do we prevent them? And we still don't really know it all. So we still don't know all of the whys, and particularly the factors involved in the disease. Well, we think we know a lot about it, but we don't know it all. Sorry. Sorry, anyone who's parked on the side of the field apparently has to move their cars. So
yeah, behind the stables.
Behind the stables, apparently. Yep.
There.
Sorry. Where was I at? So because we don't know all about the disease, it's still actually classified in the literature as a syndrome. And it isn't until we understand with 100% certainty, repeatable and tested, that the disease gets elevated from a syndrome to an actual disease. And so at the moment it's still called equine gastric ulcer syndrome because we're still researching it to find out the whys. So where does it occur? Well, we get the esophagus, very rarely, mostly the stomach, which I've talked about, and sometimes the first part of the small intestine, the duodenum. And its prevalence, through lots of good data and surveys, is somewhere between 40 and 93% of performance horses, so that's horses that are ridden, will suffer from gastric ulcers at some time in their life. So that's not all the time, but sometime in their life we believe the prevalence can be as high as 93% down to 40%. And certainly racing horses, 93% of those will get gastric ulcers at some time in their training and racing career. So lots of data there, except the only take-home message from that is that they're out there, and we know that now. We've been treating horses long enough and seeing the difference before and after, and we've been scoping horses long enough now to see the lesions and then see the before and after. There's not a lot of work on donkeys about the prevalence of gastric ulcers in donkeys, and some studies have said 50% of donkeys will have gastric ulcers at some stage. I find that a little bit hard to believe. I haven't seen a stressed donkey ever in my life. And they're not usually put in stables and fed hard feeds and trained around the racetrack. So I'm a bit dubious about that. And in breeding stock, there's very little research about broodmares, stallions, foals definitely. So newborn foals, there's a lot of research about them, and they are very prone to ulcers. But the other breeding stock, we still don't know. So what is the impact on the horses? Well, generally, as I said, death isn't something that we see, but we certainly can see colic, this issue of poor performance where your horse just isn't performing as well as it normally does. And we see some behavioural changes, girthing problems, irritability, and loss of condition. So loss of weight, failure to thrive is probably one of the most common things that we see. In foals, it's a little bit more serious than that. When we see it in foals, we see a lot more of an esophageal component. So not just gastric, but we see esophageal. And that's because the foal has not turned their stomach system from a very similar stomach system to us, to a horse stomach system, because it's still digesting milk. And that is primarily done in the small bowel, not the large bowel. But an adult horse, a non-foal horse, needs a large bowel, needs less of a small bowel. So we tend to see more reflux in those foals, like people do when they get stomach ulcers. We get the reflux. And because of that, we get a little bit more colic, a lot more pain. There's a little foal there, and we can get severe irritation and sometimes rupture of the stomach or rupture of the esophagus from the ulceration, and that's not good. So let's look at some anatomy here. The stomach this is a normal sort of stomach, and this section here is the glandular portion, which comprises about 50%, 60% of the stomach, and then the non-glandular portion here, and then the duodenum pylorus, where the food exits to go on to the rest of the bowel, and then the esophagus here at the top. The lower portion, the glandular portion, is where the acid is produced to the hydrochloric acid to digest the food, break down the food, and it has really good mucus producing cells, really good antacid producing cells that help buffer and protect the lining of the glandular portion. So we very rarely see ulcers in the glandular portion. They're designed to produce acid, live in acid, they love acid. The squamous portion, or the non-glandular portion, is not intended to be exposed to that stomach acid. So even though it takes up a fair bit of the stomach space, the way food gets layered in the stomach, the top layer where the non-glandular portion is, that's not supposed to be close to acid, is not actually in contact with much acid, and it has a very high pH, so it's not acidic. But as the food moves along in the stomach into the lower portion, it gets more and more acidic and exposed to more hydrochloric acid, and it's, that area of the stomach is designed to be able to deal with that. So that's it. So the coarser materials sit on the top of the stomach, and those are mixing also with saliva. Horses produce tremendous amounts of saliva, and that saliva is a natural antacid or a natural buffering liquid, and it has a lot of mucus in it. And if you ever seen a horse choke, you know how much saliva they produce because they're not swallowing it. It goes everywhere, out their nose and spluttering and so forth, carrying on. And that is designed to balance that acidity out in the upper section, but then it's gone and it's neutralised before it gets to the lower section of the stomach. And the high density fluids, the pH goes to 1 or 2. That's very acidic. That will burn your skin. If you had a pH of 1 or 2 acid and I squirted it in your eyes, you'd be blinded. That's the acid that people use in terrorist attacks and things like that. It's a very, very strong acid in a horse's stomach. Okay, so what then causes gastric ulcers? So we have, as I said again, this glandular portion that produces the acid and is usually safe from the acid, and then this here, the squamous portion of the stomach, which can't cope with acid but is normally not exposed to the acid. And then we have the line that demarcates them, which we call the margo plicatus. So what causes stomach ulcers? Why do they get stomach ulcers then? If most of their stomach is supposed to be able to cope with the acid, is it the acid that's causing the stomach ulcers? What are the factors involved? I said we still don't know 100%, but essentially it's a failure of a balance between the aggressive factors, so that's the hostile environment of the stomach, being in the wrong place, so being up in the higher part of the stomach in this area, and that are also overpowering the weak defences of the stomach. The buffering and the mucus lining of the stomach seems, for some reason, and again we still don't know the exact reason, is not working properly. So when you have the defences not working and a hostile environment that may be even more hostile than it should be because of dietary factors and other factors, then we get a high level of acidity in the wrong place of the stomach, and that burns the lining of the stomach, and that's what we believe causes the ulcers. So, what are the risk factors? Well, we know quite a lot about the risk factors because we know that when you look at scope horses that are in pasture 24 hours a day, wild horses, horses that are not housed, horses that are not fed hard feeds, and just have liberty type exercise, so they're not in work or in training, they don't have ulcers. They very rarely get ulcers. And when you have horses that have had ulcers and you turn them out into pasture and you put them in that environment, their ulcers go away. So we know that there's something about what we're doing with the management of horses on a day-to-day basis that causes ulcers. This is not news now. So let's look at what might be going on there. Well, the horse has evolved to eat 10 to 12 meals a day, and they graze for 1 to 2 hours at a time. So if you work that out, they're almost grazing 20 hours to 21 hours of the day, all day. It's only 3 or 4 hours that they're sleeping on not grazing. So they're designed to move continuously from pasture to pasture, low quality food, high volume intake, unlike other herbivores who eat and then masticate and then ruminate. They lie down, they vomit up regurgitate or ruminate that food, chew it again, then send it back again, digest it a little bit more, so they get every ounce of goodness out of what they're eating. Horses, as you know, you give them a lot of food at this end, where does it go? A lot of it out the back end. They're not real efficient at feeding, so they need to high throughput. And that high throughput, so their stomach is evolved for continually producing acid, continually chewing, continually producing saliva, continually digesting in the stomach food. And when it's not doing that, when we stop doing that, that's what we believe causes problems. So how do we stop doing that? Well, we do things like this, for good reason, but it is a lifestyle problem for horses in respect of the risk factor for ulcers. We lock them up. We bring them in at night. We stop them from grazing. We don't always have access to good quality pasture 24 hours a day for these horses. So they have limited access to grazing. We have episodic feeding, so we give them breakfast and dinner. That's not how a horse has evolved to eat. They're evolved to snack all day. And we give them breakfast and really good quality and really high value nutrition, not low value nutrition. But we give it morning and night, and concentrated foods that are pre-prepared for them. That's as far from nature as a horse has evolved to deal with. So when they're like that and they're stressed and then they stop eating as well because they're stressed, we get some of the factors that we believe contribute to stomach ulcers. So we also know that certain types of food produces more acid in the stomach. So foods that are rich in sugars, starch, and a lot of our foods that we feed horses unfortunately now are causing obesity and are rich in sugars, like human foods, and we get more acid produced with those. More acid is not a good thing. And we don't often have a good natural diet or supplementation for enough forage, enough hay, and because of that, we get lower saliva production. They don't have to chew their food as much. The more they chew their food, the more the saliva they produce. If their food is designed so they can just chew it a bit and swallow it and digest it, it doesn't produce enough saliva for them to produce enough buffering of the acid in their stomach. We also train them, so we give them short periods of intense exercise. There's some suspicion that exercise itself can, heavy exercise can exaggerate the propensity to get ulcers through reducing blood flow to the stomach. Sometimes our horses are stressed, we transport them, we fly them places, and we basically don't keep them the way they're supposed to be kept from an evolutionary point of view. So when they don't eat continuously, their stomach doesn't stop producing hydrochloric acid. It still keeps producing that acid. When they're not eating, they're still producing it, so the acid's got nothing to burn itself out on and to digest, and further, they're not chewing, so they're not producing any saliva, so they're not getting natural buffering. So their gastric acid increases in their stomach, the amount and the acidity of it. And these, as I said, at that point there, they produce 1.5 litres of gastric juice hourly. That's a lot to deal with. It's a lot to buffer out. Okay. And their stomach empties very quickly. When you give a horse a food, especially a high density food, a processed food, or a very high starch food, that empties from the stomach, leaves the stomach empty much quicker than a rough food, so than a hay or a pasture of poorer quality. We also give our horses non-steroidal anti-inflammatories, so bute, when they've got orthopaedic pain and other pain. and bute and other non-steroidals similar to bute are known to, through a biochemical pathway, to reduce some of the mucus and the protection in the mucus that protects those cells in the squamous epithelium of the stomach from gastric acid insult and ulceration. We also know that stress releases cortisol, which also inhibits that biochemistry pathway to protect, and that's the stomach lining. And that's the pathway we believe what causes it, the gastric acid problem. So if we look here at a horse, there's a stomach pH and it goes up and down over the course of 24 hours. You'll see if you don't feed the horse, a lot of the time of the day, the pH level is in the bad zone. So that's too high, less than 3. So with pH, the lower it is, the more acidic it is. The higher it is, the more alkaline it is. We want it above that pH of 3. Whereas if you feed a horse all day, you can see the difference. So we have a much more of a period of the stomach. Acidity is higher above pH 4. Its average is pH 4 rather than the one before, average of pH 3. So its overall acidity is lower when they're not eating all day, no feed all day, an empty stomach, versus, go that way, when they're eating all day, free choice hay. So when they can eat whenever they want to eat. So this is the science, this is the physiology about what's going on with your horse's tummies. So the gastric acidity is high in an empty stomach, and when we have intermittent feed deprivation, we get lesions forming in this squamous mucosa and no lesions in the glandular mucosa. So on day 1 here, here's a horse that has a normal stomach over there with a nice lining, and then we start to see these ulcerated areas and then severely ulcerated areas right on that margin, and that's when we start to see disease. So grain feeding, we know that grains are high in sugars, starches, and they produce in their digestion these products, volatile fatty acids, lactic acids, and some alcohols, and they just increase the amount of gastric acid that's produced, the hydrogen chloride acid. So how does exercise affect horses? Well, we think that there's some reduced blood flow to the stomach, and there's also increased pressure, and we think that the stress of exercise also reduces their appetite. And so you have a horse here that between March and June, nothing changed except they just went into work, had the same feed, and you can see a massive deterioration between that period just from exercise. We also think that horses get this stomach pressure from exercise, the increased abdominal pressure from being exercised, especially intense exercise like galloping, and they push that stomach acid up past this line where it's not supposed to go, into this area that's prone to acid damage. The physical stress we've talked about, and the behavioural stress, those are all part of it. In our horses, probably the training is not such a big part unless you're a racehorse trainer, but still endurance horses, eventing horses, that coupled with the stall confinement and the other management changes, have put those horses at greater risk than a horse out on pasture. And if they're in pain, they've got an infection like their uterine infection, they're being transported, you're mixing them constantly with horses that they're not socially comfortable with, then you will get these stresses. Young horses that have been broken in high stress, they're in high stress environments. Those horses we know are much more prone to stomach ulcers. So the exercise we've discussed. So as the exercise increases, the pH decreases, which means it gets more acidic. So not only does that acid get pushed up into the wrong bit of the stomach through stomach pressure of exercise and abdominal pressure, the acidity for some reason of the stomach goes up as well. So it's a double whammy in exercising horses. And you see that here in this graph, that's the pH there of the stomach samples taken in a non-exercising horse of pH of 7, and then you come down here and they drop down to 0 during exercise, and then 1, during exercise. So exercise itself produces this change in gastric acidity, as well as forcing the gastric acid in the wrong place of the stomach. Physical stress, we see these other behavioural problems as well, like wind sucking, and horses that are in pain have high levels of natural cortisol, and they're often on bute. So those are two double whammies of risk factors to produce stomach ulcers. So here we have the effect of confinement. Here is a normal horse that's just come off pasture on day 1, but when it went into a stall on the left, and then a picture on day 7 of just confinement, but still had hay. So it wasn't fed any hard feed, wasn't exercised, but just had the stress of confinement. And you can see this is a normal, healthy stomach lining to an ulcerated stomach lining just within 7 days of confinement. So that was strict confinement, and didn't come out of the stable, but no other changes in that horse's life. Okay, so clinically signs, a lot of you will be aware of this, they go off their food, they can have poor body condition, attitude changes, their performance can decrease, and occasionally we get intermittent colic and mild to moderate colic. So colic is not a big factor of the disease, but it's definitely there in some horses, especially with severe ulcers. In foals, as I said before, it's a lot more serious, the clinical signs, and they really go like this. They get very colicky often with stomach ulcers, and one of the key things is they grind their teeth. You'll hear a foal constantly grinding its teeth and mouthing all the time. So these are foals that are still mothering, nursing foals, so baby foals up to 5 months of age. So on the lab test, not that helpful. Blood tests aren't that helpful at diagnosing gastric ulcers. Response to treatment can be useful, but the only real way of diagnosing it is seeing them, so with a video gastroscope or a gastroscope. So we have a new gastroscope, and we've been playing with it quite a lot since it's arrived, and there's our team gastroscoping. So this is the scope itself on the left. It's basically a camera on the end of a 3-metre tube that we can flush through and send water down and take samples if we want to, and it displays on the video screen here behind us. We can record it, take images, and we can see what's in your horse's stomach. We have to do that with your horse starved, because if the stomach is full of food material, we can't see anything. It's blocking the way. And we can't get a horse to vomit. Horses don't vomit, one of those few species that can't vomit. And so we starve them for at least 12 hours overnight. 9 to 12 hours is ideal. And then 4 hours without water. And then we can scope them with a high degree of accuracy. We're also not only just looking for ulcers, of course, but we're looking for other concurrent disease. And that would be bots, enteroliths, which are stones, gastroliths, and feed impactions. And the species, or the little animals that get the feed impactions, so feed balls in their stomach, certain feeds can cause that Guilford grass and so forth. Which breed of horses get those feed balls more commonly than any others? Minis. So little minis get very, very prone to feed balls in their stomach, and that's just like a big ginormous basketball sitting in their stomach, and it doesn't dissolve. And we treat those. Do you know how we treat those? Coca-Cola, yeah. If you give them a little bit of Coca-Cola, not too much because it's quite high in sugar, so you can induce some other complications with the sugar, but the Coke will actually eat away at the feed ball and get rid of it. So it is one of the few uses for Coca-Cola in the treatment of horse disease, but it does work, and we do use it when we see them. So well done, Helen. Then occasionally we see these things. We see bots. And I'm a little bit worried that we're probably going to see more bots as time goes by in our horse populations as we scope more horses, because unfortunately, and Sue will cover this, is that bots are not one of the parasites that we can check on a fecal test. So when you do a fecal egg count, it won't tell you whether your horse has or has not got bots. The only way to tell whether your horse has got bots is find them in the manure as larvae, which is very uncommon, or you'll find them on gastroscope. And this is a horse that we scoped the other day, Tammy's sister's horse, and he, I think a Trendy is a he had bots. And so when we see these ulcers, we grade them where they are in the stomach and how severe they are, so that we have a record. So that's a normal lining of the stomach there. We have an intact epithelium lining, and that reddening is normal. Down here is that acid. It's not rising up above here, and it's just a little bit of acid that's sitting in the bottom of the starved stomach. And then we start to see a grade 1 lesion, which is this slight irregular pattern on the line, and then we start to see some spots of bleeding and a little bit of ulceration in the back further from the margo plicatus. And then even bigger, they're getting larger and going further back from the edge, which is probably indicating that acid is still rising up higher. And then really, really severe lesions, where they're all joining together and there's not a lot of normal, healthy squamous epithelium at that margin. And those horses are definitely clinically sick with stomach ulcers. So what's the strategy with treating stomach ulcers? Well, we want to eliminate the clinical signs. That's pickiness of eating, that poor failure to thrive, the behavioural changes, the colic and so forth. Promote the healing and prevent reoccurrences and complications. So how do we do that? Traditionally, now that we know more about the management factors, so the feeding, the housing, the stress, the training, the exercise factors that are involved, we focus on those as prevention and treatment, and then we've sought medical therapies. And the medical therapies have been mostly unsuccessful until the development of the proton pump inhibitors, the acid pump inhibitor medication, the omeprazole. We tried all of these things, cimetidine, stuff that you would normally buy from a human care, antacids, gastrolyte, those sort of things that you would take for gastric reflux, indigestion. We tried them in horses, not particularly effective in horses, not that effective in humans either. So we know that if you do these things for diet and feeding, you will definitely reduce the incidence of stomach ulcers. So that's limit any periods of fasting, increase their roughage, turn them out on pasture as much as you can, so don't confine them. Have the free choice hay. Lucerne hay is a good choice because it's a natural antacid, so it in itself is a good roughage, and calcium carbonate supplements can help because they're natural buffers as well. But overall, reducing the grain and concentrate is something that will definitely help in ulcery horses. So providing roughage throughout the day and night, so lucerne, mixed hay, Rhodes hay, that seems to help buffer the stomach contents. And if you're going to feed concentrates, little bits and often, so feeding a number of feeds of your concentrate, so that's your pellets, your cubes, the grains. If you're going to do that, try and spread it out during the day. This is the gold standard. It's often not practical for the way we house horses, but I can only tell you what the gold standard is, and if you've got a horse with stomach ulcers, then these lifestyle changes will make a big deal of difference, and they're often easier than having to medicate and scope your horse. As a rule of thumb, the amount of grains and cubes and pellets and processed feeds, concentrates you give your horse should be no more than ½ kilo per 100 kilos of body weight. Sorry?
Is that per feed or throughout?
Per day. Per day. Yeah, split over the day, Nathan. Yep. So there are some oils that have been proven to decrease the stomach acid production and give you protective factors, and those are the omega-3 and 6 fatty acid oils. 1 cup to once to twice daily seems to be the recommended feeding guide for those, and corn oil is the one that's got the highest level of those. But there are some really good products that are made with other omega-3 and 6 oils. You can research those from your stock feeders. Rice bran oil is also pretty good, but it can get rancid very quickly. So, and if it gets rancid, it actually will cause ulcers. So one of the tips, I think, if you're giving oil to your horses, especially in today's conditions in summer, is you should always keep your oil in the fridge. All right? The more the cooler it is, then the better it will be and last the protective factors in it will last longer, and the rancidity won't become a problem. Limit your stressful events, so if you try not to combine them long-term in stables, don't overcrowd them in groups in paddocks, and we think that certainly collecting stallions can be one of the things that can really stress out stallions, that whole process. So transport, again, reduce your transport or put them on protection during transport. The medical management, as I said, hasn't been that successful except for the acid pump inhibitors, and that's the omeprazole, and there's lots of different brands, and the one we use is the is one of the ones we use is the Gastropel. Antibiotics and supplements and herbs don't seem to play a great role, although people have reported anecdotal success with them. A lot of them are not tested in terms of before and after to know how effective they are, but you'll read lots of literature about aloe gel and turmeric and things like that. At the moment, the jury is still out in the medical community about how effective those things really are. They certainly don't seem to make the problem worse, so if you want to feed aloe or turmeric, then that's something that is up to you. But if your horse has got stomach ulcers, I think that you want to get rid of them definitely, go for the omeprazole.
Slippery elm?
Yeah, slippery elm is part of that. Yeah, it's still unproven yet, the slippery elm. Yeah, and those products are still untested. So that's the traditional. The initial medication that came out that we used in the early days was cimetidine or Zantac. It was a human medication that that was also prescribed for people with gastric ulcers, and it wasn't that effective in horses, and it needed to be given 3 or 4 times a day, which made it fairly unattractive as a treatment option. And the ulcer coating agents, the sucralfate, those again are not particularly effective in horses. We do use them in refractory ulcers, but again not very commonly. The one we still go for is the omeprazole. So let's have a look. Next one. So the natural agents here. So these are the herbs that there's some evidence: slippery elm, aloe vera, the adaptogens, which are a funny sort of herb. I don't know much about adaptogens, but I saw that in the literature. Licorice, marshmallow root, banana peel, and all. People have tried everything. These ones down the bottom, the pectins, lecithin, silica, the gamma, they don't seem to have much effect at all, and the amino acids probably not very effective at all. The antacids definitely will help neutralise the acid, but they just do it for a very short amount of time. And whether you can get enough into a horse to neutralise the acid for enough period of time to reduce that average pH is debatable.
How long are you keeping the horses on APIs for? Is it individually and you're waiting for clinical symptoms to receive?
No,
or are you saying 4 weeks?
So how long do we keep them on the proton pump inhibitors, the omeprazole? Usually 2 weeks is enough, yeah. So the usual clinical treatment course is a 2-week course, 10 days to 2 weeks, yeah, depending on the severity. And whether we can effectively make those management changes that we're talking about. I mean, if your horse is locked up because it's got a cracked radius and you've got to keep it locked up in a stable 24 hours a day and it's going to be stressed and it's getting stomach ulcers, 14 days isn't going to cut it. You're going to need it on omeprazole all the way through its treatment to stop it from getting stomach ulcers, because it's going to be on bute as well. So it's a bit dependent. There are some occasions where we keep them on it for longer. Okay, so this is how the cimetidine works. Was worked at this upper level here as a H2 receptor agonist, but the omeprazole or Gastropel works here, and it stops the production of this acid, so we don't get the hydrochloric acid here in the stomach. The antacids work when you give it and it's in the stomach. So it's a much more effective way is to stop the acid production rather than neutralise the acid with an antacid after it's already in the stomach. So the best feeding practices are regular feeding. The less time, so this is a take-home message, the less time a horse has an empty stomach, the better. Now this sounds like it's easy to achieve, but in some of our horses, they shouldn't be eating a lot of food. So how do you keep their stomach full but not have them too heavy and laminitic and so forth? That's shitty quality food in small amounts often, and making them eat. The analogy would be trying to get them to eat fried rice with 1 chopstick. Okay, they're just gonna get a little bit every time. So we've got to slow down how they eat, and what they eat's got to be really low quality, and it's got to last all day. We've talked about loosened hay. Don't ever train your horse, exercise your horse on an empty stomach. And if you've got a horse that you're setting up for heavy, intense exercise, they're the horses that you want to watch very closely, their eating behaviour, and maybe scope them to make sure they're not getting stomach ulcers during their training program. So they can affect any breed, any age of horse. You can, as a rule, we now believe that you can prevent them through good management. So that is just turn them out in the pasture and just look at them. Who's going to do that? All right, we're not going to do that. So, but the clinical signs can be very, very subtle. So the gold standard for diagnosing it is really just through gastroscopy and response to treatment. So what your horse is like before we started on omeprazole and what it's like afterwards. We generally don't get long-term side effects of the treatment or side effects of the ulcers themselves. So although they're sick and they're not right, we don't. Once they're healed, and so that's why they can go long periods after treatment and come off treatment. In very few horses do they need to be maintained on and on omeprazole to stop ulcers or keep them at bay. Most horses, if they get an episode of gastric ulcers, we can treat them quite successfully with a good program of management changes and the omeprazole. So that's the conclusions. We don't know too much about pregnant mares and breeding stock, so I think that information is yet to come. But I suspect that they'd be pretty low at risk because most of them are out grazing in paddocks, so they're pasture fed, most mares, and they're not in exercise. You know, they're pretty docile, they're pretty unexercised, so they should have a low incidence, which is why no one's really going looking for ulcers in those horses. We definitely find it is an expensive disease to manage in your horse. The treatment is expensive. The omeprazole, it's expensive from a management point of view. You've got to dose your horse every day, and it will have effect on the behaviour of your horse, especially show horses and things like horses where temperament affects their performance. Then this becomes an issue. So, and it can be very easily confused with other things that change your horse's temperament, like back soreness and even just overnutrition. So some people we think are treating ulcers when they don't need to be, and there's probably a whole lot of people that are having horses and are ignoring the signs, and their horses do have stomach ulcers. So the best way to go is to get them diagnosed properly if you're worried, and then treat them if they've got ulcers, and then check them afterwards to make sure the ulcers have all gone away. Okay. So I'm going to open up some questions. Any questions on gastric ulcers at the back there?
Notwithstanding the massive different physiology between humans and horses, the Nobel Australian guys that discovered that the pylori bacteria was responsible for the ulcers in humans, has there been any type of research, or it's just never, it's just not the same?
So the question is that in humans there was an association between gastric ulcers and the Helicobacter bacteria, and in fact the famous Australian scientist infected himself, I think from memory won the Nobel Prize, infected himself with Helicobacter pylori and induced ulcers in himself to prove that it did cause ulcers. But what we now know in humans is that not all ulcers are caused by Helicobacter. And certainly that's been something that is looked at from a veterinary point of view. And we don't treat other species really very much with for gastric ulcers. It's really only horses. I mean, dogs, cats. How many of you have got a dog that's on gastric ulcer medication? Jules is a very competent, experienced small animal vet.
It does happen, but not that often.
You don't treat them, whereas it's an everyday thing in horse practice. So